In the headlines today, external splint or amputation, oxygen for ulcer healing, and animal fats increase diabetes. Walking gait is more normal after a below-knee amputation than if an external splint is fitted to the injured leg. These are the findings of a naval orthopaedic team dealing with traumatic lower leg injuries. Gait was analysed for 10 limb preservation patients using the Intrepid Dynamic Exoskeleton Orthosis, or IDEO for short, and 10 below-knee amputees. While walking, limb preservation patients spent less time on their affected leg and walked more slowly. Amputees had more dynamic gait and better power in both the affected and unaffected limbs, with peak values closer to the norm. So while amputation requires significant adjustment, a good outcome can be expected. Diabetic foot ulcers appear more likely to heal and less likely to end with amputation when hyperbaric oxygen therapy is added to conventional foot ulcer care. Researchers combined results from 9 randomized studies of 1,500 patients and found that foot ulcers exposed to hyperbaric oxygen therapy were significantly more likely to heal, they healed faster, and the need for major amputations was reduced by 70%. During hyperbaric oxygen therapy, a patient is placed in a compression chamber for 1 to 2 hours, where they inhale 100% oxygen. Treatment is usually given once or twice daily for 15 to 30 sessions with careful monitoring. Access and cost are both factors in the availability of hyperbaric oxygen therapy. Fats from animal sources increase the risk for type 2 diabetes according to a large French study. 71,000 women were asked about their consumption of various types of omega-3 and omega-6 fats and were tracked for almost 20 years for diabetes. The more fat eaten, the higher the risk of diabetes, but the kind of fat made a difference. Those consuming the most arachidonic acid and omega-6 fat found in meat, fish, seafood and eggs increased their risk of diabetes by 50 to 74%. Those eating the most DPA and omega-3 fat found in meat, fish and seafood increased their risk by 45 to 50%. However, ALA, an omega-3 fat found primarily in flaxseed, canola oil and walnuts, showed 0 to 17% increase in the risk of diabetes. So remember that diabetes risk is only based on sugar consumption, but also on animal-sourced fats. I'm Dr. Nerida McKibben, and that's today's Health News.